Well, today's health topic is brought to you by the Orange County Eye Institute, and it's very important that you treat your diabetes, but a lot of people probably don't realize that it also affects your vision. And Dr. George Salib is joining us today with the Orange County Eye Institute. Thanks for joining us today.
Thanks for having me.
There's a lot of talk about diabetes, but I don't think people realize that it actually affects your vision, quite a bit.
Yeah, indeed. In fact, a lot of people go by and they have diabetes, and then they don't realize that what's affecting their vision. Then all of a sudden they start to see blurred images, and then they figure out, well, what's going on?
Right.
So diabetic eye disease really affects people who have diabetes.
Right.
And diabetes is basically a disease of blood sugar. So the elevated blood sugars, which are caused either by insulin, lack of insulin, or a resistance to insulin, starts to cause damage to the vessels inside your eye that line the retina. And once you get damage to those vessels, they can start to have little outpouchings, little microaneurysms, they call it, hemorrhages.
Similar to what we see here on the screen?
Exactly. You see on the left, you'll see a normal retina. This is what I'm looking at when I'm looking inside your eye if your eye is dilated. So you have the nerve surrounded by all these blood vessels on the left, and everything looks kind of clean there. On the right, you could see that there's a hemorrhage there, so you can get large hemorrhages and bleeding inside the eye, as well as even retinal detachments and even certain types of glaucoma and fluid leakage, and that's all as a result of that sugar affecting those blood vessels and making them weak.
How can a person tell that diabetes is actually the effect of these things? Could it just be a coincidence, or is it usually you can tell and narrow it down that diabetes has caused this effect to their vision?
Right. Well, that's a very good question, and you have to look at their overall history. That's why when we take a patient into our clinic, we will ask them a bunch of questions to see what is their past medical history. And if they have high blood pressure, for instance, or diabetes, or kidney disease, or high cholesterol, we take all those factors into consideration to look at what might be causing the disease in your eye. And there's certain patterns that are more familiar or more characteristic of certain diseases, and we take that into consideration.
Now, a person with diabetes will have a vision that looks similar to this slide. How gradual is that before something like that happens?
Well, it's a great question, because in fact, in the beginning, you might not notice anything. You might not notice that your vision is blurry if the blood spots, for instance, inside your retina are not exactly in the center of your vision. But once it starts to get into the center part of your vision, called the macula, and you start to get leakage of fluid there, that's when you'll start to get these blurred and distorted images. Wow. And even blind spots, and even blindness if you get a huge hemorrhage or detachment.
How common is that for people that suffer from diabetes, that they'll actually have this effect on their vision?
You know, diabetes is the leading cause of new blindness in the United States in ages 25 to 74. So it's a huge problem. In fact, the CDC estimated that about 26 million people in this country alone have diabetes, and about 3 times that have prediabetes. Worldwide, you could see this graph. Basically, in the beginning, like now, we have about 177 million people in this country alone, in the world, 171 million who have diabetes, and that's thought to more than double by the year 2030. So wow. It's a huge problem. The scary thing is that half of the people that know they have diabetes, they never seek eye care, or they don't get the appropriate eye care. And it becomes a huge burden, not only for themselves, but on society in terms of health care costs.
Now, this affects people of all ages, because we talked just briefly during the break.
Right.
It's not for 50 plus, people. As
right.
you age, you kind of go through this process. You have children that actually can suffer from this as well.
Exactly. There's a couple of types of diabetes, type 1 and type 2. So kids, they have a lack of insulin production, and so they can get them, in the early years, 5, 6, 7, 8 years old. However, and then type 2 diabetes is usually as a result of a lack of insulin receptors, or a downgrading of those receptors, so that you don't have so much response to the insulin. And that's as a result of obesity or a lack of leading a healthy lifestyle. And that the length of time that you have diabetes affects whether you get diabetic retinopathy. So usually After about 15 years, about half of the people will have some changes in their eyes as a result of diabetes.
So what kind of treatments do you have available for someone like this that's suffering from that?
Well, always the best treatment first is prevention. So you have to lead a healthy lifestyle as much as you can. Eat right, exercise, don't smoke. All those things are important to try to minimize your chances of developing diabetes. And the next step, once you have diabetes, if you get diagnosed with that, is to have good access to health care, going to your doctor regularly, and to make sure that you get treatment for that if necessary. Now, what can we do for treatment? You could see on the left, there's an eye that has lots of little white spots. So laser is a very good treatment. So all those little white spots is where the laser actually hits the eye if you have a lot of leakage in your eye. On the right, you could see an image of an eye being injected with a medication that actually helps to decrease the amount of leakage by decreasing the amount of blood vessel growth in your eye that comes as a result of diabetes.
So basically these remedies are trying to get that vessel to kind of constrict and get back to its normal shape and function compared to this hemorrhage that's now developed in your eye.
Right, the idea is to really try to get those blood vessels to not grow and proliferate as much. And blood vessels tend to grow when you have a lack of oxygen. And if you have blood vessel damage, there's a lack of oxygen which causes that blood vessel growth. So really strict blood sugar control is very important. And it's been shown in a study here in the United States and in the UK that strict control can actually decrease the rate of progression of diabetic changes in your eye by about half.
So that hemorrhage, is that, when we saw that blurred vision slide, is that the hemorrhage that's actually causing that kind of block?
It could be the hemorrhage itself blocking it. It could also be a leakage of fluid into the actual retina. And that it's like looking through water if you have that leakage. And that's all as a result of that sugar affecting that blood vessel, making it weak.
Very interesting. So obviously some very important information for anybody that's suffering from diabetes, and if you're not suffering from diabetes, I probably would guarantee that you either have a family or a friend that has some kind of diabetic condition.
Right.
So it's important that they see you. And you also speak to clubs and organizations as well regarding some of these topics.
I do. I'm always available to speak to that. I love educating about these topics. I'm always available to give any lectures, if necessary, about this and other topics.
And the most important thing, too, for someone like this is nutrition, like we talked about, and your lifestyle, right?
Exactly, yeah. Nutrition is extremely important. Remember, what goes into our body makes up our body. So we really should think twice about what we eat and try to decrease those complex carbohydrates and eat a healthy meal.
Right. Well, if you'd ever like to have the doctor speak at one of your clubs, especially even the Vision Impaired Club that we have here in our community, give them a call at 770-1322 or visit them on the web. That's the OCIinstitute.com, and they'll get you any information you may have. And of course, very important information, especially if you suffer from diabetes. Thanks for joining us this morning.
Thanks for having me.
That's Dr. George Salib. He's with the Orange County Eye Institute. Give them a call at 770-1322 for any more information regarding your vision, or if you'd like to have him speak at one of your organizations. We'll be back with more of the Channel 6 News Hour right after this.